the inaugural session of Healthcare Innovation Conclave. We have with us Sri Ranjan Kumar, Secretary, Medical Health and Family Welfare Department, Government of Uttar Pradesh. He'll be continuing with this presentation. Let me also take this opportunity to invite Dr. Pankaj Jain, IAS Director, Health Services MP, and Managing Director, MP Public Health Services Corporation, to come on stage, please. Can we have Dr. Pankaj Jain on stage, please? I just saw him. Maybe our colleague can help him to get inside the hall. Also, I would like to invite Vikram Pagaria, Joint Director, National Health Authority, to come on stage, please. Mr. Vikram Pagaria. Neha, can you kindly see where the speakers are? And I was also been told that Major General Professor Atul Kotwal, SMVSM, Executive Director, National Health System Resource Center, if he can also join us on the stage, please. Sir, please come. With this, I will hand over the session to Sri Ranjan Kumar, Secretary, Health, Government of Uttar Pradesh, who is also the program chair of this conference, to carry on with this presentation. Over to you, sir.
I have started with the basic background of our state, that people living in different geoclimatic zones and they have different socioeconomic and cultural background. So that brings a different pattern of diseases in different part of our states. And to meet the medical needs that require a lot of innovation and planning. So UP government is on the forefront of technology and innovation, and we are working simultaneously on many fronts, like developing good portal, feeding real-time data, and using good analytics to bring action on the field based on. So on the daily basis in my mobile, I get update about communicable diseases, the basic symptoms available in different part of our states, and we immediately send team there to take actions for preventive as well as cure. And also the different problem faced earlier in the public health facilities. We have done lot more things to strengthen those public health facilities, not only in bringing good infrastructure, new thinking, new model of making quality health services very close to the people, like as Chief Secretary sir told, that the Arogya Mandir, earlier that was called Health and Wellness Center, that is based in 5,000 population. So basically in every village you have now a Arogya Mandir where you have more than 16 diagnosis facilities and also more than 70 drugs. So we have complete facility, and also at the same time in the Health and Wellness Center we provide a teleconsultation facility. So I have visited many, and you see the vibration there. People are there, at least where I visited in Barabanki, in Badaयूं, more than 10-15 people were there, and they were in queue for their turn to get to the teleconsultation. So I will go through the remote. उसी पे होगा
Sir.
Okay. So the way we worked, so I will go through these tools for promoting ease of healthy living through good governance and use of technology. So good governance include putting good quality doctors where required, and technology for better monitoring and making sure that people are there. So so see in area of technology, we have implemented attendance management system to improve service availability of Ayushman Bharat Health and Wellness Center. I will go in detail also. E-rupee watches for increasing access to ultrasound services during pregnancy. This was unthinkable of earlier. The pregnancy cases now have regular checkup as anyone with good background of socioeconomic, the frequency with which they visit ultrasound center. Now everyone from any background, from any rural area, now they can visit the regular these ultrasound, they can avail ultrasound services. A scan and share module to minimize waiting times. And regarding people, we have an innovative way of introducing direct recruitment of a specialist doctor. So that is on the basis of reverse bidding. So in Sonbhadra, in many places, we are even paying more than 5 lakh per month for the people who intend to work in very remote areas. Creation of a specialist cadre for regular doctors like L2. Earlier, we used to take people only in medical officers rank. Now we directly recruit specialist cadre doctor. And the second is creating localized training ecosystem to ensure timely availability of community health offices. This is very innovative and very rigorous and intense training program with very useful content, and we are making sure, so whenever you meet these community health center offices who are available at 5,000 population, you will not able to differentiate between a doctor and CHO. So he is having minimum good knowledge of the diagnosis and the drugs. And third is delivering a specialist services in Ayushman Bhava. So this campaign, this is very innovative in we conduct Swasth Mela. See, you reach to the people through, as I told, Dastak, which we do 3 times in a year, where from the 13 department, people do focused activity. So they go door to door, they do door to door campaign, and they immediately they do follow up and make sure that prevention as well as cure is done. Similarly, in Ayushman Bhava, you have Swasth Mela at PSC level, at the sub-center level, where we are introducing the higher up doctors, the specialist doctors, to see their referrals. And also this has created the people who are like, they are not able to convey their things, so they easily come to the Swasth Mela. So we are able to identify those and we are treating them. And this is continuing medical education. This is very innovative. So more than in 12 subjects, very, very high specialist subjects, we are imparting training, regular training programs to the medical officers. So in this, the problem statement, obviously absenteeism of CHOs, even to the other paramedicals and other doctors, this is a big problem for the public health facilities. So we have introduced the technology and innovation. So this has now outcome, you can see that every 88% CHO are reaching regularly. So whenever you visit, you see these people are there, very regular, on time, and even see the teleconsultation services. Can you imagine a person from the village? So I was sitting in one of the household in the rural area in Badaयूं. So one of the member, he was missing. So I asked where she is. So they told कि just वो दवा लाने गए हैं बगल के दुकान से. मैंने कहा कौन सा दुकान? तो I understood then it was health and wellness center. So now they treat that as a very nearby available, these high level of consultations and drugs. So there is a concept of hub. So when I visited this health and wellness center, so you have a hub of doctors. So if that CHO is unaware of things, that symptoms and all, So he can immediately connect to the good doctors. Also, at the PPP mode, in the investment summit, we have proposal of more than 35,000 crores from a company who is willing to install these teleconsultation kiosk in villages and with a hub of very high caliber doctors. So that will, I think, bring a kind of revolution where you have very good audio and you can hear very the clean voices and you can easily advise what is the cure. So this is very good initiative. And then e-rupee voucher, this is game changer. So now we give a token this to the mobile, so they can use these our this financial token to pay to the ultrasound, the visit to the private. So this is totally reimbursed by us. So now every the pregnant women, they afford to avail all these ultrasound services. So we now have, we are able to list the high risk pregnancy based on these diagnosis, and we can treat in time. So we are saving lot of lives now. And this is a scan and share model. See the queue. So if you use these scan and share model, so see, you are alone there. So usually you reach to the counter and avail all the medical services. So we are working in this area in a very focused manner. So so Government of India through national this NHA, they have come up with a very innovative new concept of microsite. So basically microsite is a basically landscape of different health facility, including the smaller one, less than 50 beds, and including individual doctors, clinics, diagnostic center and all. So what we are doing, so we have employed interfacing agency and development partners. So they have done this piloting in Mumbai and in Gujarat, and they were very successful in bringing them into ABDM, this Ayushman Bharat Digital Mission Platform. Basically, this is a kind of internet network where when you get a IP address or when you get a connection, so you are now have access to trillions of things all over the world. So similarly, in Ayushman Bharat Digital Mission, once you get ABA ID or any doctor getting HPR, the professional registry, name in the professional registry, or any health facility getting HFR, so they are immediately on that platform. So they can avail the high quality applications, services, easily they can know who are the best doctors in this field, and doctors, they can improve their efficiency because they include the financial as well as other non-medical services. So immediately, so they can easily improve the discharge, and for the insurance also, that facility can have a good this MOU with insurance companies and also that bring in totality, complete digital solution of healthcare. So this we have just started. So in the future, we can imagine that on the mobile, on the dashboard, you have different symptoms. Just you click when you are getting fever. So immediately there is a call from a very high, good quality doctors. Ki, Ranjan, I know, because once you give the consent, your all the earlier the history of your thing goes to that doctor, and immediately he will say nothing, this is just a fever, just to take paracetamol or nothing. So can you imagine the confidence level that person, they will immediately take paracetamol and go to the hospital. And based on earlier history, he can say, oh, it is again reoccurrence of that thing. So be careful, take rest, and go to the diagnosis center, have again this blood test. So in the future, this is in the future. So even also we are thinking about like HMIS model where outpatient model in that, where you just scan the QR code, you get appointment in any of the doctor, any of the facility all over the country, that at 12, suppose in the evening 6 in Chennai, so I can immediately organize myself to go there 6 go to the waiting room at 5:45 and you visit the doctor at 6. So that will bring zero queue in all the hospital, in all the health facilities. And so that efficiency, the more number of patients they can cater. So this is win-win case for everyone. The private facility, for government, and they are working on analytics also. So they will create anonymous kind of, in ABDM, this is complete anonymous. So nobody can see your thing. You are suffering from what? Nobody can see except you. So he is the main boss, but they are working on anonymous data so that they can do analytics on that, so that they can create new policy instruments or new strategy and new planning and new innovation in policy, in working implementation also. So ABDM is a very big initiative and we are working hard. So in India, NHA, they have declared that they will go for the 100 microsite in all over the country. So immediately we took that opportunity. As he said, our Chief Secretary, the UP is a new place where you can think of growth, you can think of any innovation immediately. So we grabbed that opportunity because the mall is that here. Immediately we went for 35 microsite in one state out of 100. So they have implemented, I don't think more than 8, 9. So we have immediately launched 35 microsites. So now in coming weeks or so, we will start giving results, the first cases, second cases, so adopting the private facility into the ABDM. So this is a big initiative. So if this is successful, we will go for all the 75 districts. So can you imagine in coming years, we will have all the health facilities. So even in Clinical Establishment Act, we have provided for, they have to display their details outside their hospitals. So that include the name of the professionals, the doctors. So HPR, what that did, this HPR facility, this has the process that MCI verify that doctor, and then our facility verify that he is working there. Can you believe once you have HPR, so you are dead sure that this person is genuine and is really available in that facility. So there are complaints, they say that this doctor is available everywhere. So you go there, you meet ward boy and other doctor who is actually is not there. So this ABDM thing will bring a complete change of things in this field. ये चल नहीं रहा? Yeah. So see now we have created a specialist cadre. So I think this is almost more than 3,000 a specialist doctor we can recruit. So till now we have recruited 1,209 specialists in regular positions, and apart from 198 contractual specialists. This is very interesting, so that now we are utilizing KGMU expertise. So this program is regular, so annual intake capacity is 60,000. So you will find well-trained nurses everywhere. So this government facility now have very quality service providers and personals available everywhere. This is unique. I don't think any of the states, these kind of regular, rigorous training programs is happening. So this, as I told, in Ayushman Bhava campaign, you have a different mela where people are very, very comfortable in coming there, and so they find sometimes very, very complex symptoms, and they are cured. And these 826 students who are doing MD/MS, so they are very useful in giving health services. The result, you can see that more than 1.28 lakhs, this 12,13,7 in Mela, in 1237 lakh people visited. Minor surgery be by way of follow-up, we have done 6,000, and major surgery 2,000. This is great achievement, great success. See, this continuing medical education, so more than 12 subjects. Our director administration, Raja Ganapati, is very passionate, and he conducts regular training programs, the very high quality, very disciplined. And really, I found this no less than any Masuri training or any IIT or any, very rigorous. And this is very innovative. So now people are knowing. So when I was district magistrates, I found many times they are unaware. The doctors in the government facility, they are unaware of these things. But now they all know because of this regular package of a specialty continuous. So this is very good innovation. So innovation not only comes from digitizing the records and all. You have to look into the e-governance, that e-part and governance. So you have to innovate in governance also, and then bringing technology to make it e-governance so that it is fast, efficient, and accessible, inclusive, and sustainable. So we are working on every facet of things, and regularly we are in talk with all, like a special secretary, our CEO and all. We talk about how to innovate more. So definitely when they came up with this idea of conducting this conclave, immediately I said yes. Because anything you get from others, we can implement here. So I'm very looking forward today that to hear from specialists, the people who are passionate in this field for the innovation, to bring back something to implement. Thank you so much for giving me this opportunity to tell you what we are doing.
Thank you so much indeed, Sri Ranjan Kumar, Secretary Health, the Government of Uttar Pradesh. And it was a detailed presentation which has shown us the kind of work being done in the state. And also, it's quite heartening for me personally, because I'm always vocal for leveraging technology innovation. And your presentation actually encompassed how technology innovation is being leveraged in the state of Uttar Pradesh. You also emphasize on the E part of governance, that is playing a major role when it comes to imparting healthcare delivery to the masses at large. Thank you so much. With this, we had a Uttar Pradesh perspective. Let's have a perspective from another Pradesh, that is Madhya Pradesh.